Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back, everybody. Welcome back. I'm Dr. Thomas Grove. You're listening to Living Pain-Free, the educational program. We're talking about your musculoskeletal orthopedic needs. Maybe you have an ache or pain, maybe an injury, and you're trying to avoid an unnecessary elective orthopedic surgery, and maybe regenerative medicine's a good idea for you. What we do is we take healing cells of the body, platelet-rich plasma, stem cells are good examples, do a simple set of injections, get that tissue healed up from the inside out, and hopefully avoid an unnecessary surgery. So give you guys a chance to talk to me live here in the studio. Use a fake name if you need to. If you're driving, please be safe and pull over. That number to call here, 866-870-5752. That's 866-870-5752. If you give us a call, we're going to send you a copy of our book for free, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. You can pay the postage for you on that. And if you'd like to get a free consultation over the phone with our staff, that number to call is 800-300-9300. That's 800-300-9300. If you want to get in touch with us, email is a great way to do that. Check out our website. There's a spot on every single page for you guys to send us an email. While you're there, check out some videos of us doing these procedures. Check out a few hundred pages of educational content. Our website, www.jointrehab.com. That's www.jointrehab.com. So I wanted to chat with you guys today about a very important aspect of musculoskeletal medicine. It's something called referred pain. Okay, so let me kind of get into the details about this one. Again, every time that we go on the radio here every week, we talk about how important it is to do a good, proper hands-on physical exam, because sometimes it's difficult to pinpoint where someone's pain is actually coming from. So when we talk about things like referred pain, what that is where you have, pain in one part of your body, right? So you come into the clinic, he's like, man, I got some pain right in this spot here. But referred pain is this phenomena where you actually have the source of the pain somewhere close to it, but actually at a different spot than where your brain is interpreting it, right? So this happens because that nerve pathway from different areas of the body, right, they come together in the spinal cord and the brain. And sometimes it makes it a little bit difficult for your brain to really pinpoint the exact location of that problem. Common examples of this, guys, I'm sure you guys, know somebody who's had a heart attack, right? A very classic sort of sign of a heart attack. Even though we know the problem's coming from the heart, sometimes your body will interpret the pain maybe being in the neck or the shoulder, for example, right? Very, very common for that to happen. And so, when patients come in and they say, hey, I've got pain in this area, many times it's a referred pain pattern. Now, I know that can be kind of confusing. So the way that we tease that out and figure out, okay, where is this pain truly coming from? That's the hands-on physical exam, right? I got to stress that tissue myself and see exactly what's going on. So what a good example to bring up here this week. It's someone that was convinced with 100% certainty that their pain was coming from their shoulder, right? So they had some pain in the shoulder. They had an x-ray, had an MRI, had some very mild arthritis, some very small, we call them, degenerative sort of tearing of the rotator cuff. But when I brought them in, I did a physical exam. I couldn't reproduce their pain in the shoulder when I, was pressing on the shoulder, right? And so when we're doing that, we want to make sure we're also examining the areas around where someone's pain is coming from for this reason. So in this case, someone actually had pain that was coming from their neck. So a really fun little infographic you guys can check out. So if you're listening to the show, pull up your phone, pull up your laptop. I want you to Google this for me. It's called cervical facet referred pain pattern. Okay, cervical facet referred pain pattern. pattern. So what this shows is that different levels of the spine, okay, have what we call facet joints. Okay, these are little tiny joints. We've got them on either side of the neck bones that allow a little bit of movement, right? A little bit of flexion, a little extension, a little side bending, right? Provides a little stability to the neck as well. And these are tiny little joints, right, where two bones come together. There's some capsule there. There's some synovial fluid in there that allows that joint to be lubricated and move smoothly. But these little areas can be kind of tricky. So when I actually press on all the way up in the neck, they're like, oh my gosh, that's where my shoulder's really hurting, even though I'm not pressing on that shoulder. So I know it's kind of a confusing sort of thing, but these referred pain patterns are a very, very common thing that we see. So we actually ended up treating their neck and not their shoulder. And that's actually what got them some pain relief. So I know it can be a very confusing thing trying to pinpoint where your pain is coming from. And again, it's a huge, huge reason why we don't only go off of what your radiology report says. Because in this case, if I just treated their rotator cuff, that's not actually where their pain was coming from, right? So very, very important that we're figuring out, where your symptoms are coming from as we're putting our care plan together. Because if we don't, we're just guessing, right? That's why we see a lot of these times people have surgeries, or maybe they have a regenerative medicine treatment just in the incorrect area, which can be avoided with a good, proper hands-on physical exam. So we got to make sure we're reproducing those symptoms and figuring out, what's truly going on with you. But when you see these sort of things for the first time, you don't forget them, right? I always say in medicine, you're probably not going to find something if you're not looking for it. And so we got to be really thorough in trying to figure out what's going on with you. And again, don't just trust your imaging report, because many times that's got nothing to do with where your pain is coming from. So very, very important that we figure out and pinpoint what exactly is going on with you. And then from there, we can make our determination, hey, is this something we can get after with regenerative medicine? Or is this something that we just let go? Maybe it's something that we can treat conservatively. Or is this something that you truly need surgery for, right? And I know that can be a very confusing thing to go through, especially when you're having pain. That's something that's not fun to deal with. You just want to get relief, right? So I always encourage folks, get as much information as you can. If you're not comfortable with what's going on and you're thinking, man, I got a pretty big surgery that I got scheduled here, let's just double check. Let's see if there's something else that's going on here that we can treat more conservatively, right? Maybe with regenerative medicine, using PRP, stem cells, which is a much, much less invasive way to get after these sort of issues. Very, very easy thing to hit with that musculoskeletal ultrasound. It can be very specific. These are really tiny joints in the neck, the little facet joints, very, very small. And I can put that needle within about a 0.5 millimeter, right? I can put it directly on target, be very specific where we're delivering those healing cells. And then from there, very important that we, give it a good rest period after a treatment. Every so often I get a patient who doesn't like to listen to us, right? They go and go exercise right away. And they get frustrated because, man, I'm not getting better. So remember, very important after we do a treatment, the aftercare includes, avoiding exercise to a treatment area, right? So if I'm doing a knee, maybe a hip, maybe an ankle, those are good weight-bearing joints. Not the time to go on those long walks, hiking, running, sprinting, squatting, lunging, that kind of thing. If I'm doing, a shoulder in an individual, not the time to go for a max bench press or anything like that. We want to let that tissue get inflamed, start to regenerate, proliferate, and then from there that tissue matures, and that's where we get the really good results with this kind of treatment, is we're actually healing that tissue from the inside out. A couple other reasons, guys, why we don't get great results with regenerative medicine is if we're taking something called an NSAID medication. That's called a non-steroidal anti-inflammatory drug. Common sorts of medications like that, that's your Motrin, your Aleve, ibuprofen. Now these are strong anti-inflammatory medications that will actually disrupt that initial phase of healing, which is inflammation, right? We want a little inflammation to jumpstart that healing process. So folks who take those sort of medications, a lot of times just don't get as good of results, typically need more treatment, takes longer to heal. Similar to that, an oral steroid like prednisone, especially at higher doses, can be something that limits tissue healing, right? So those are very important things to consider after a treatment, as we're not, limiting the healing. We want to maximize our results, right? Save you time, save you money. Again, another really common thing is just, not giving this thing enough time. Looking at the studies, we're talking about a couple of months. Some studies even suggest maybe a couple of years where that tissue continues to regenerate, continues to remodel. So if you're not better after a couple of days or a couple of weeks, again, this is something that can just take more time. It's a very common occurrence. that people, need more than one treatment and they need, more than a couple of weeks. Sometimes it is a couple of months before people have significant benefit and significant relief of their pain. I know it's a frustrating thing because the alternative to this is just shooting you up with maybe a steroid or maybe some numbing medication, which you might kind of be lulled into doing, right? That's their traditional sort of pain medicine model. Remember, guys, again, we got all the research here showing that steroids are a really bad idea. It actually damages tissue, does not help with the healing process at all. So you kind of, you win the battle, but you lose the war, so to speak, right? You can get that steroid shot, feel better for a couple of days, couple of weeks, if you're lucky, a couple of months. Then you get another steroid shot. Now it works, but maybe it doesn't work as long. And then you get another one, and then another one, and now it's just a couple of days of relief. And now when that pain inevitably comes back, the pain's actually worse than it was before. And again, the reason for that, steroids are actually, they're toxic to tissues. It's actually very damaging to tissue. So it's a very powerful tool, but it doesn't really help in the long game, right? What we'd rather do is get some healing cells in there and actually heal you from the inside out instead of just covering it up, right, with a steroid shot. Not to mention, your typical pain medications. I can go on a very long talk about what a bad idea it is to go down that rabbit hole. But obviously very, very addictive with our whole opioid epidemic that we have. We'd much, much rather our patients not go down that route and not go down the pain medication, addiction process. We'd rather, heal you up and really, cut off that pain signal, which would be something that we can do with some tissue healing instead. Just a much more conservative way to go. We very frequently get people, off their pain medications, or we can wean them off once we actually get to the core of what's, generating their pain. And if we can heal it from the inside out, we can hopefully get you off of these medications that are just so damaging to tissue. So it's a more conservative way to go. I know it takes a little bit longer sometimes. If I gave you a pain pill, right, you probably feel better within a couple of hours. But with regenerative medicine, just might take a little bit more time, but it's a much, much better way to treat the human body. In terms of, side effects of the treatments that we do, really all we're looking for is a little bit of inflammation, right? So what you as the patient might experience is a little bit of, extra stiffness, maybe a little bit of extra soreness to that area, which is totally normal. We a lot of times, patients will have a little bit of maybe worsening of their symptoms just initially after a treatment. Again, that's that initial inflammatory phase before the tissue healing kicks in. Typically a couple of days, once in a while a little bit longer than that, but very, very conservative. Again, very sort of different in terms of the complication rate compared to something like a surgery or, getting hooked on pain medications. So we'd much rather, heal that body from the inside out, get to the core of what's going on and heal it, as opposed to just put a Band-Aid on it and covering it up. So very, very important that we, look at what all the options are when we're looking at a care plan for somebody. So got a couple more minutes here, guys, left in the second half of our segment. I'm Dr. Thomas Grove. You're listening to Living Pain Free. We're talking about your musculoskeletal orthopedic needs. Maybe you got an ache or a pain. Maybe you've got some instability of a joint. Maybe you stretched out some ligaments or some tendons around a joint and things are just feeling a little bit loose, right? It's a very common thing we address here as well. And what we do is regenerative medicine, right? Using the power of the body's healing cells, platelet-rich plasma, and stem cells, using injection therapies to put healing cells directly into these tissues that we want to heal up. Pretty straightforward. We put some healing cells into damaged tissue. Tissue can heal up, rinse and repeat as necessary, and get you back in the game. And again, this is something that a lot of times people think you got to be a professional athlete to receive. That was kind of the origin of me discovering this regenerative medicine, was from my athletic career. Again, I played football for the University of Nebraska, ended up getting into strength and conditioning after that, where I was training some pretty high-end athletes. So what I do is I take contracts with professional athletes. I live with them, do all their cooking, all their training, and I saw the power of this stuff and how if we avoid surgery, do injection therapies, we can, keep people in season sometimes, prolong somebody's career. Very, very powerful stuff. But nowadays, you don't have to be a professional athlete, right? We certainly get those sort of folks in. But we also have, your everyday person coming in, your weekend warrior, again, anybody who's trying to live an active lifestyle, which we love, right? We strongly encourage you to keep that body moving, to optimize your overall health. This is something that can be a very powerful tool to keep you living that lifestyle. A lot of times people have an injury and they don't get it taken care of, and now maybe it hurts when they're trying to do their exercise that they enjoy, and it just puts them on a different path, right? So, we talk about the mental health benefits of exercise, and when we take that away, right, things like depression, anxiety, when we're not exercising, maybe we're putting some body weight on, right? And again, all these things are kind of a negative sort of spiral that can lead you down a very, very different life. So what we'd rather do is break that cycle, heal that injury up, and get you back in the game, right? Get you back to exercising again. Again, using a very straightforward technique. Take the healing cells, concentrate them down, and deliver them under ultrasound guidance. That's our imaging use of choice with simple injection therapies. These treatments are pretty straightforward. To make PRP, or platelet-rich plasma, we do a simple blood draw, right? Like you're just giving a blood test at your doctor's office. We take that blood, spin it down in a machine called a centrifuge. So what that does is it concentrates down those good healing factors that are floating around in our blood. A lot of platelets, right? Things like exosomes. There's some stem cells in there, growth factors. So that's called platelet-rich plasma. It takes about 30 minutes or so to actually prepare, so pretty quick process. And then we can also use something like stem cells, right? The way we can get that is through the bone marrow. We use a simple set of numbing injections. Use a small needle, extract some bone marrow from the back of the pelvis, a little area called the posterior superior iliac spine, or the PSIS. Pretty easy way to get your body's own stem cells. Concentrate those cells down, and we can use that to inject as well. But the idea is we got damaged tissue, put some healing cells directly where we want to heal up some injuries. Give yourself a little rest period, repeat that process as necessary, and then from there, get you back to living a good, healthy lifestyle where you can move your body, right? The tough part with a lot of our patients is they're such active individuals, they don't know how to shut it down, right? I'm just as guilty as the next person. I'm a pretty terrible patient in that. I've got better over the years, but before, anytime I'd have a regenerative medicine treatment, I had a really hard time avoiding exercise. That's just, who I am. It's part of, what keeps me healthy is I like to exercise once, sometimes twice a day, just to keep that body moving, keep my energy up, right? Keep my mood up. And so one of those things that can really derail you from having good results with this kind of treatment is, you're just exercising that treatment area too much. So very important that we're, I always say to patients, hey, just chill out. This is the time to let that tissue calm down, get some healing going. Then we take it for a test drive, right? Come back in a couple weeks, see how you're feeling before we get you cleared for physical activity. And like we mentioned earlier in the show here, sometimes it's a pretty quick process. Me, myself, I've had a lot of treatments all over my own body. Sometimes it's a couple days, I'm back in business. Sometimes it's a couple of weeks. Sometimes it's a couple of months. Impossible to say, for sure how many treatments somebody needs. What day am I going to feel better? I wish I had a crystal ball. Unfortunately, that's just not how medicine works. So we have to stay patient with that healing process and see exactly how your body responds, right? Even within the same individual, some things heal faster than others. It really depends on, how you're feeling, what your symptoms are, before we really have confidence to get you back to activity where we're not going to be in the same position we were previously. So again, can work pretty quick, but sometimes takes a little bit more patience, certainly. So a couple more moments here, guys, left in the second half of our segment. So I want to give you guys a chance to talk to me live here in the studio. You're listening to Living Pain Free. I'm Dr. Thomas Grove. We're talking about your aches and pains, musculoskeletal injuries, maybe how regenerative medicine using platelet-rich plasma, which is PRP, or stem cell therapy might get you back in the game and heal that tissue from the inside up and avoid an unnecessary surgery. So that number to call me live here in the studio, 866-870-5752. That's 866-870-5752. If you give us a call, we're going to send you a copy of our book for free, even pay the postage for you. Title of that book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And if you want to get a free consultation over the phone with our staff, check us out. We're at 800-300-9300. That's 800-300-9300. If you want to check out some videos of us doing these procedures, check out a lot of educational content. Our website's a fantastic resource for you that you guys can check out absolutely free. Our website is www.jointrehab.com. That's www.jointrehab.com. Spot on every page for you guys to send us an email. Speaking of which, I get a lot of emails. It's a great way for you guys to get in touch with us. a great way for you to get some more information and see if a consultation is a good idea for you. We get to help a lot of folks just through emails, so make sure you guys are checking this out. I got an email here recently. I had somebody who said, hey, I've got lower back pain. I had a previous surgery, and I had a previous diagnosis of facet syndrome due to disc desiccation. Can you help? ? So a couple of things there. We already talked about the cervical facets here earlier in the show. So we've got facets all the way down our back, right? The upper neck is the cervical spine. The middle back is called the thoracic spine, and the lower back is called the lumbar spine. So this is somebody who had some lower back pain, and facet syndrome is basically where we have some inflammation, maybe some arthritis and those little facet joints. Remember, arthritis is where that joint starts to get inflamed, starts to wear out. Cartilage starts to wear down over time, which can be certainly something that's very painful. And they talked about how they had something called disc desiccation. That's just where the disc gets a little bit dehydrated, and it can lead to something like degenerative disc, which is a very, very common thing that we see in a lot of our patients, especially as we get older. It's just a very common finding that we expect to see. Anytime I'm ordering an MRI for somebody of their spine, I always warn them, hey, listen, we're probably going to see some degenerative disc. That's totally normal. So this is something that, if we want to get after it with regenerative medicine, again, getting back to basics, got to be specific where we're going to deliver those cells. So facet joints, very, very easy target to hit, but many times we've got a lot of structures around that facet that can also cause pain for folks. So there's little ligaments, tendons, muscles around the facets that can also benefit at times from injections. So pretty rare for me just to inject a facet. Many times there's other things around that area that are also causing pain and discomfort for folks. But again, the very important aspect of figuring out where your pain's coming from is that good hands-on physical exam. So this is somebody that if it is just truly coming from the facet, again, very easy thing to address. Again, when we just take those healing cells of the body, platelet-rich plasma, stem cells, it's kind of a deeper structure, so I like to use ultrasound for this one especially, where I can aim that little needle directly into that small little joint space, right, go into that little capsule of that facet, hit the little ligaments and muscles around that area as well. And this is something that, with enough treatment, a lot of folks get great, great results with it. Because the alternative to this, again, is pain medications, steroid shots, epidurals, back fusions, which, again, is a really, really, really complicated, invasive sort of procedure to do that we want to avoid at all costs. So many times we can save people from surgeries like that. But the idea is we want to avoid going down that route, because once we have that fusion, it just sets you down a line of probably needing further surgeries, right? When we start to fuse segments of that spine, inevitably, right, that level and above and below where that fusion is gets worn out, and you get talked into another surgery, and then it gets worn out above and below that level, then it's another surgery, and then God forbid you had a complication of one of those surgeries, which can set you back even further. So this is something that if we can just put some healing cells directly into that little area and get some healing going, get your pain under control, we can avoid those sort of scenarios in a lot of cases. So very, very common thing that we see here. We already talked about cervical facets as well. Again, same thing happens in the thoracic facets. Getting back to basics, we got to do a hands-on physical exam to determine where that pain's coming from, especially around the spine. There's just a lot of stuff, a lot of anatomy in that area that can cause pain. So we got to be very, very specific where we think that problem's coming from before we put a care plan together. So that's the end of our segment here, guys. Thank you so much for tuning in. I'm Dr. Thomas Grove. This is Living Pain Free. Let me give you guys that phone number if you're interested in a free consultation over the phone with our staff. We're at 800-300-9300. That's 800-300-9300. If you want to check out our website, shoot us an email, www.jointrehab.com. See you next week.
Living Pain Free with Dr. Marc Darrow and Dr. Thomas Grove. Now that you've heard Dr. Darrow and Dr. Grove, call their office at 800-300-9300 and speak to one of their staff for free. And ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate. Don't operate. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain Free with Dr. Marc Darrow and Dr. Thomas Grove is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870 The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.